they've come in for their initial visit, and we come up with a problem list, and they've decided, this is what we're going to do to restore my mouth and get myself into optimum health. And the question is, how am I going to pay for this? So, that's the question everybody asks, and we try very, very hard to make it affordable for everyone, because I think that everyone deserves to have a nice smile, to be able to speak well, and to be able to chew well. So the first thing that we do to try to help people manage the expenditure of the investment into their oral health is we try to help them maximize their insurance. So if they have insurance, we try to figure out a way that we can get the maximum benefit from that. Now, one thing that people need to remember is that dental insurance is very different from medical insurance. Medical, when we go to the doctor, we pay a $5 or $10 or $15 copay, and then we don't know what the rest of it is, but there may be, another $500 that the insurance company pays for. So, and all that stuff is covered by insurance. But with dental insurance, it is better for a person to look at it more like a coupon. I'm getting a discount, but it's not you pay a copay and then the rest of it's paid for. And that's something we run into a lot. People come in and they kind of got the medical insurance mentality. I'm going to pay my copay and then the rest of it's paid for. So it really helps for people to kind of get the right mindset. Insurance can be great, and like I said, we have some wonderful gals in my office that know how to maximize that for the person. So that's our first order of business, is we really, if they have it, we try to figure out a way that what's going to be most beneficial for them. The second thing that someone can do to pay is, obviously they can pay with their credit card or cash or check. I mean, that's pretty obvious. And then the third way would be is to try to figure out financing. And financing, in our office, we offer CareCredit, and then we typically have a couple other companies that we might be working with. These tend to change over time depending on conditions of the economy, but we try to offer a couple of different options. We love CareCredit because CareCredit offers a program where they have a 12-month same as cash program, meaning that if it's financed over 12 months, we, as the dental office, we pay the interest for the patient. And so the interest is paid to CareCredit, but then the patient is able to pay over a 12-month period the balance of whatever it cost. And so that's a wonderful program. CareCredit also has other 18 and I think 24, maybe even more extended payment programs. The other things that I have seen people do and that I hadn't thought about until recently, but we had someone tell us, hey, I can use my IRA penalty free. And people can dip into their IRAs and they're not taxed on it. It's because it's for a medical dental purpose. And so we've seen some people do that. We've seen people use co-signers and family members, and then of course you can use a combination of all these things. Maybe you can maximize your insurance. Maybe you can pay some cash, or you put some on a credit card, and maybe you can do some on one of these financing options that we have. And a lot of people will use all three of those methods to make it more manageable. Sometimes we can segment their treatment plans up over maybe a year or two. We come up with like a phase 1 therapy and then a phase 2 therapy, where here's what we need to do this year and here's what we need to do next year. And that's helped a lot of people, and they may use a combination of all these things that I've discussed. And we put all these things in place so that a person can easily manage the investment that might be necessary to enjoy the benefits of having teeth that they can smile with and chew with, and also speak well. And it's been really important to me, because this is one of, there's two main barriers that I've seen that will prevent someone from getting dentistry done. One is the cost, and this addresses that, and then of course the other, which we've discussed, is fear.